这样是不是对的？
对。
好，好，那就开始。OK， Good morning。好，那就开始。OK，Good morning, ladies and gentlemen. And I'm so glad to see all of you are in good health condition, even under the serious epidemic of this coronavirus in terms of COVID-19. And the purpose of this webinar meeting is to exchange our information and experience regarding to the epidemic of the coronavirus. And the host today is the president of our Association for Dental Sciences of Taiwan. And there are many scholars from different parts of the world come to join this webinar. And let's start with Dean Professor Heiko Spalek from University of Sydney, Australia. Heiko, please.
So before we start, to make it a little bit better for everyone, Ellen, can you click on Manage Participants on your screen? And then there is Mute All, because then we don't have the feedback and everybody can hear better.
Okay.
That would help a lot.
Okay, I will do that.
Yeah, thank you.
Okay.
Because it's really hard to concentrate, I think, if you have this. So thank you very much for, okay, I don't think that has worked yet.
Is it okay now?
No.
Not yet.
You have, at the bottom of your screen, there is a Manage Participants.
Yes.
You see that? Manage Participants?
Manage participants. Wait a moment. We'll do that. 在哪里？管理与会者这里，在这里。
要这里来，
这里。
Manage Participants. And then mute all.
OK， 所以要整理这一条。
OK， 那我
Super.
来这里给你。
It's not yet.
我来坐这里。
And then afterwards, you just unmute the person who presents. Okay.
I think now it's all mute, except for you and our side.
Thank you very much. That sounds very good. Thank you. I hope now everybody can hear better. So thank you very much for inviting me and allowing me to share what we experience here in Australia, and I feel very honored to do that. So I will try to stay in the 10 minutes I'm allotted. First question, can you all see my presentation at the moment? Yeah, can you just nod? Okay, good, I see everybody nodding. So whenever we do a presentation here in Australia, we acknowledge the traditional owners on the land on which we meet. They have exchanged knowledge here in Australia for 65,000 years. And when we share our wisdom, we also pay respect to their accumulated wisdom and pay our respect to their elders, past, present, and emerging. So I just wanted to make clear at the beginning what this presentation is not about. And it's not an introduction into virology. It's not blaming others for being not prepared. It's not about epidemiology of COVID-19. And it's not about the misguided public, like you've seen in the news that in Australia people fight about toilet paper, despite the fact that this is not a GI infection. So I want to talk briefly about the transmission routes in dentistry, infection control, realities and myths, and then the impact this crisis has on dental education, and provide some resources. So first of all, we know that because of what we do in dentistry, there's a huge amount of potential spreading of the infection by dentists. And as you see here in this slide from the New York Times, dentists and paramedics are really at the top of when it comes to spreading viruses, which is really a huge problem for us in dentistry. The transmission routes in dentistry are obviously mostly through high-speed handpieces. That's why in Australia now the guidelines are to avoid these and reduce really to emergency procedures. And if they have to be used, it needs to be in especially under pressure rooms. And that's obviously a huge issue for us. If we talk about infection control, it's really about face touching. That seems to be a real problem for many people. And while we were assembling here, I've observed the people with their camera on. Many of them actually touched their face just in these few minutes before we started. And it is really easy to do this. And it's clearly one of the major infection routes which are affecting all of us. As this is a virus which essentially contains RNA surrounded by a lipid, hand washing with soap is actually the way to go to reduce the likelihood of infection. So it's really important that we teach our students and staff and patients hand washing skills, and obviously that includes a 30 seconds at least of strong foam building hand washing. There have been a few papers and announcements about using cloth mask because many countries now running out of PPE, personal protection equipment. And if you look at the literature, we will find that these cloth masks compared with medical mask and no mask are actually quite dangerous because they contain the virus and allow the spreading even more. So if you see this in a controlled study, cloth masks are probably not the way to go. If you look further into infection control measures in dental practice, we also see many flaws in the literature. We see a lack of differentiation between aerosolization and airborne transmission. Remember, airborne transmission is something like measles, which you can get even 10 hours afterwards if you go into the same elevator without touching anything, versus airborne versus aerosolization, which only stays for up to 60 minutes in the air. There are many other myths around, like for instance, I've seen recently a staff guide which said you should have a shower before going to work, talking about killing the virus. Obviously you cannot kill a virus, it's not living, and a lot of other things which really need to be questioned. We also saw a lot about virus detection via PCR. You can often see the virus even a long time after exposure to a surface in the PCR. And that means that there are myths going around that the virus will survive 9 days. There's someone very noisy. Can you mute yourself? Or Alan, can you remute people? Thank you. Oh, that's still going on. I will wait until Alan has a chance to mute Delga Bajal. I don't know who this is, but it's very noisy. I think others have problems understanding.
Hello.
Okay, it seems to have subsided the noise now. So, no, it's not. Can you, the host, can you please mute all? Because there's, again, a lot of noise.
No.
No.
Is it okay now?
Just click on manage all participants and then click on mute all.
Yeah, we already mute all of everyone. Yeah, so okay, I muted the moderators one. Okay.
Yes.
Thank you. The PCR detection is really an issue because you can even see 9 days later in the PCR remains of the virus. And obviously that's not what is important, because what's really important is if the virus is viable, and that can only be determined by cell culture. So we need to be very careful when we analyze that literature. So let me switch gear a little bit and talk about the impact on dental education. And I thought it would, I thought it would make sense to differentiate here didactic teaching, simulation clinic, clinical education, and then obviously dental research. So if you look at didactic teaching, that seems to be the easiest for everybody, at least here in Australia and New Zealand. There are a lot of tools like Zoom we are using now. There are a lot of guides how you use teaching for Zoom, which really helps us to deliver our didactic content, as well as tutorials and interactions with students. So I would almost say this is not a problem for most institutions, as long as the bandwidth is there. In the simulation clinic, this is much more complicated. First of all, we have an ethical dilemma there, that we get accused of wasting PPE, which is obviously in the current time where there's a shortage, a concern from an ethical perspective.
Someone in what sheet dentistry.
Thank you. So the next question is the aerosol infectious? Obviously, if you drill with high-speed handpieces or with any other handpieces in plastic teeth, they're not infectious. But some of my students have pointed out, what is if someone coughing is on the plastic tooth, and then you drill into the plastic tooth and distribute the virus this way. And then there's the transport, getting to the simulation clinic. Some of my students use public transport. That's obviously an issue. They could potentially be infected during their transit. And then there's reduced capacity of our simulation clinics for social distancing, which increases expands the hours, and that increases staffing costs. So it's not so easy to just say we have fewer students in the sim clinic. That inevitably will increase the hours there. And then there's the clinical education. There's obviously a huge risk of nosocomial infection for our patients, and I think that's probably at the top of the concerns. And that's why all dental schools in Australia have now ceased clinical education for the DMD, for the dental programs. We are still conducting dental clinical research, clinical education for our specialist trainees, the ones who become orthodontists and periodontists, endodontists, and so forth. Just to put this in perspective, in the state of Washington in the US, the governor has now put out an order. So dental educators are potentially subject to major penalties if they perform non-emergency procedures. And there's clearly a shortage of surgical masks and N95 respirators. And that will probably stay for a protracted period, which obviously makes is an issue around what we can do and what we cannot do. Australia is currently under level 3 restrictions. So if you, later we will share hopefully the slides here, you can click on this and take a look exactly what level 3 restrictions are. But if you kind of sum it up, it's essentially emergency treatment only. So that creates huge opportunities also. If you think about teledentistry, that's something which we clearly need to embrace more and more to determine who actually needs to come to the dentist instead of bringing everybody in and create crowding and waiting rooms. So let's briefly talk about dental research. In our institution, human subject research has essentially stopped because if we bring new human subjects into the research environment, we expose them to additional risk of infections. So something which was a low-risk research project maybe in the past has now become a high-risk research project. So that's really something we need to keep in mind. And then there's the problem with lab-based research. What happens if we have to decontaminate after an exposure? So let's say one of our research assistants tests positive for COVID-19. What do? We have the options of decontamination, which will pretty much kill all reagents and all cells or any equipment in the lab, or we close the lab for 4 months. Both of these options are not very attractive, and that's why most of our research, lab-based research, has ceased now, except for some things which we have kept. So I want to finish up with giving a couple of further resources here, which probably might be helpful to think about this in a larger context. First of all, we should learn from history. This great book by John Barry about the great influenza. And many of you know this probably as the Spanish flu, although it didn't originate in Spain. It was just reported first there. And we have looked at what happened in Australia. 40% of the Australian population succumbed to the flu and 15,000 died. My university closed until May 12th of the year, which was about 5 weeks. And students were very upset about this because they missed lectures for 5 weeks. So we always have to see this on historical context. ADEA, the American Dental Education Association, has put out a nice pandemic resource guide for dental education, which obviously, as you can see here from the different sections, covers a lot of different things. Some are very US specific, like financial aid. I don't think anybody here would be interested in that. But other about well-being and resilience might be of interest. Then we have the American Public Health Association, which also brought out a very nice COVID-19 statement, which might help us for oral health because it has an oral health section in it. And then I think we really need to watch out that we don't forget mental health aspects. A lot of our students and staff are in isolation now, mainly self-contained. So they are very concerned, and I think it's our duty to think about the mental health status and the well-being of our staff and students, and put a couple of resources here. And this is my last slide, and I'm pretty sure Prof. Ellen can later share the slides. You can also get to the PDF of the slides if you follow the Linktree link, which is here at the right upper corner of my last slide. So if you go there, you can click on the PDF and get the slide.
Wait a minute.
Okay, 你可以讲。
Thank you. Okay, thank you, Heiko, for providing us so many information. And because we are a little bit behind the schedule, so let's move to the next speaker, Professor Xie Chu from Hong Kong University, and he's currently the president of C.
Hello. Hi, Alan. Can you hear me? Hi, Alan. Can you hear me?
Yes, yeah. Very clear.
Okay, good. So good morning, everyone. So see if I can share the slide with you. Okay. Say, can you get that?
Yeah.
Can you see the PowerPoint?
Yes. In front.
Okay,
Yeah.
great. Good. So everyone can see, right?
Yeah.
Yes, yes.
So today my topic actually, I'm asked to talk about the influence of the COVID-19 in Hong Kong dentistry. So actually I changed the topic a little bit. So I want to share with you the impact of the COVID-19 on dental service in Hong Kong. First, actually Hong Kong is close to China. Hong Kong is part of the China. So this is a very important topic to us. So every day you can see in the government, actually they develop a website. It's the www.coronavirus.government.hong.kong, and to inform the people, the public, that what we have done to in this in the midst of this virus disease. So everyone can go in the website and get the latest information. So the next slide I want to share in this is the yesterday information in Hong Kong. The confirmed case is not very high; it's about 582. Unfortunately, there is one person passed away due to 4 person passed away. And then every day, today actually I heard that is another 59 people get infected from the disease. Basically, they are incomer from Europe. So every day we have news about the COVID-19 informing the people. And from yesterday onwards, the government has issued a recommendation that we cannot go to public together for 4 people or more. And also the restaurant are advised to be spaced, and actually better to close down the cinema for 14 days from yesterday, because we expected there will be a surge of the infection in the coming 14 days. So what is the impact in the dentistry in Hong Kong? Before that, I want to share, we need to know more about the all healthcare system in Hong Kong first. In Hong Kong, there's about 2,300 dentists working in Hong Kong. The service basically is by the private practitioner. Okay, and the government dentist, the role is to provide dental care for the civil servant and some emergency care. So we follow the guideline by the Center of Health Protection. And the center, the CHP, the Center of Health Protection, advise us how to do during this COVID disease. There are 2 different levels of alert, and now is the emergency level of alert to the public and to the dental professional. And then dental procedure performed in Hong Kong need to wear masks. Proper PPE is recommended to use N95 for procedure that create aerosol. So this is the guideline by the Center of Health Protection in Hong Kong by the Department of Health. So what are the impact, okay, on the dental services? I'm going to talk about first the government dental services, what is the impact, and then there are other services provided by the NGO, the non-government organization, and these are basically is subsidized, but it still need to self-finance to make sure the cost is they can balance the income and the expenditure. And also, mainly the service is provided by the private dental practitioner. And lastly, I will talk about the dental service provided by the Prince Philip Dental Hospital, the only dental hospital in Hong Kong, and also the only dental training school or the university to provide dental education. Let's talk about the government dental service first. For the government, actually, they issue a newsletter to everyone. Now, because of the coronavirus, and the government actually has closed down non-emergency service. Basically, they are not providing scheduled dental care for the civil servant and to the public. They only provide emergency care. I would say basically there's no dental, no scaling, no restoration. So it's only pain relief, and the pain relief basically they try to do it in a non-surgical way, and if possible, try to avoid to create aerosol in the dental clinic. So this is the press release by the government to talk about the dental clinic. So the dental service is only limited to dental emergency and pain relief. The government also released a letter to the public to update the novel coronavirus infection. In this letter, it mentioned that it is important for dental provider to have full PPE and hand hygiene before they see patient. And for every patient, they need to make sure that they take the temperature, check the medical history, talk about the symptoms, to check about the symptoms of the COVID-19. And also, every patient, they must ask about the traveling and contact history before they committed to any dental care. And for dental care, there is pre-treatment mouthwash with chlorhexidine. This is recommended, but actually some will suggest chlorhexidine will not actually really kill the virus. And also they recommend the use of high volume suction and then rubber dam isolation for any aerosol generating procedure. But they also say that aerosol generating procedure should not be done by not only the government dental clinic, is also advised to general practitioner not to do create aerosol generating procedure. And then actually the next slide is I would say dentists are making face shield. And in Hong Kong, there's a shortage of face shield. So you see this dentist, actually he's the vice president of Hong Kong Dental Association. He's making face shield for himself and also for this his ancillary staff. So you can see this face shield is disposable, need to be changed when there is contamination. And then actually dentists in Hong Kong is also wearing head cap and also full protection PPE. For coronavirus, actually the government also have issued updated information in the web. And also newspaper is giving us up-to-date messages for the decision, because there's rapid changing scenario. So every day we have more and more announcement from the government to update the changes. As I mentioned, now we have to limit public gathering to 4 people since yesterday and shut down cinema, gymnastic area, and also social sport as cases actually increase every day in double digit. Today, we have another 59 people got infected and hospitalized. So that will really, really have overwhelmed and make a burden to our hospital service. So also today, also there's another news that we suggest to not only the government, but to all dental practitioners to postpone all non-urgent treatment and suspend all aerosol generating procedures unless rubber dam isolation can be applied. But in fact, actually, it suggests try to stop most of the non-urgent procedure. That means basically they ask them to more or less to close down the clinic except open for emergency care for pain relief only. for 2 weeks, for the coming 2 weeks, at least for the coming 2 weeks. And for private practitioner, and also the government said that they should consider risk of the widespread transmission, okay, the risk. So that means they need to calculate the risk. Once if there is a case identified visiting the clinic, they have to shut down the clinic for 14 days. And also try and also ask the public, the general practitioner, to limit their services to minimal level, only to pain relief and emergency care. So how about the dental hospital? As I mentioned, the dental hospital is a teaching hospital, so we have to suspend all face-to-face teaching activities. It's replaced by online course. Staff are suggest to have home office, use Zoom meeting, and then the hospital still provided limited emergency service for pain relief for emergency only. But basically, I would say the hospital is more or less shut down because of the coronavirus disease. And also, not only the clinical service, the research activity is limited to only to the ongoing research that cannot be stopped. We are not allowed to start any new service activity in our hospital. I mean, even in the laboratory. So for us, for the Hong Kong U, the only dental school, the only teaching hospital in Hong Kong, we will resume our teaching by phases, but we still not have a plan what is the day to resume the service. It really depends on the situation. So we are evaluating the situation day by day. If we want to reopen the service, it will start only to the simulation lab teaching first, and then by classes, and the priority will be given to the final year student. I want to highlight the final year student because they are more significantly affected because we expect they graduate in this summer. But unfortunately, because of the coronavirus disease, they have to cancel many clinical activity. So they cannot, we will expect they cannot graduate in this summer. The earliest will be at the end of August. If the coronavirus condition is not controlled, they may need to extend after August. That means maybe in December. So we don't have a solid plan yet. But definitely this coronavirus disease shutting down of the dental hospital affect the teaching, so affect this batch of graduate students graduating this summer. So if you go to the hospital website, basically it's an emergency condition. All hospital visitors need to have the temperature measurement, wear face masks, and record the we have to record the personal information, including the identity and the contact phone number, just in case we need to contact them if there is any infection. So these are the situation in Hong Kong. For the last slide I want to share, is there a big impact? Yes, that will affect the people receiving dental care in Hong Kong because of the shutdown of the government dental service, or I would say the restricted dental service provided by the general practitioner. So what is the impact to the general dentist? So basically in Chinese, actually there are Facebook, many messages talk about that because of the coronavirus disease, the widespread, basically a lot of dentists, they don't have enough revenue. And then the Hong Kong Dental Association is negotiating because also they have limited amount of the PPE. So the Hong Kong Dental Association is helping the dentist member to get enough PPE from the government and from overseas to meet the demand. And also, the Hong Kong Dental Association will try to negotiate with the landlord, okay, because of the loss in income. They hopefully the landlord can give some support, okay, to lower down the rent, so and so, and also see if the government can help them to pass to go through this difficult time. That is what I want to share. Thank you.
Okay, thank you.
Thank you.
帮我打开我，我的 user
你可以直接讲。
哦，可以了吗？Okay, thank you, CH.
Yes.
And two things I would like to ask all the speakers. The first thing is because most of all of your information provided is very important. I would like to ask your permission if we can share your slides with others. Because
yes. Actually, I sent a copy to IO already. Yeah.
Okay, thank you. And the second thing is because our time is our schedule is a little bit behind. So I would like to ask the next presenter to make precisely about 10 minutes. And so thank you, Xiech. And the next speaker will be Professor Chen Rongwei from Loma Linda University. Rongwei.
Hi. Hello, everyone. Professor Xu, please unshare yours so I can share my slide.
CH, can you stop your slide share? Yeah.
Thank you very much. So what I bring today is a very simple presentation. It's the impact of COVID-19 to the dental education in USA. So right now in the United States, everyone knows we're just still resume the #1 of the nation of the whole wide world, which is we're the #1 in the cases, and it's 142 cases, 142,000 cases, 2,497 deaths. The most severe 3 states are New York, Washington, and California states. Loma Linda is in California. If you've never been here, next time when it's not locked down anymore, that will be a good place to visit. In March 16th, we've been told by CDA to close all dental clinic just for only emergency. And also even most of the emergency one, they will suggest to be treated in the dental center. So that means Loma Linda University, the School of Dentistry, become the center of providing all the treatment. However, our school have already stopped all the students from coming in before that. So a week before, our school have already told the student all the classes has to be online. So if you have never been in Loma Linda before, this is a picture of Loma Linda. So it's very close to each other. Why do I put the picture? This is our School of Dentistry. And this is our hospital right next to it. And this is the church. And we have a children's hospital, so right behind. So it is a whole group of hospital. So in this situation, the first one that's we close is all the schools closed and then move all the classes to be online. And then hospitals are still open, but hospital entrance, because now between the entrance between the dental school and hospital has to be controlled very strictly. And as you know, probably most of the Asians are very careful and treating this very seriously. But unfortunately in United States, it was not treated seriously enough at the very beginning, unfortunately. So Loma Linda is a university that is in the blue zone, which means a lot of people that live in Loma Linda, you're living over 100 years old, chances 10 times more. than the other cities. However, that also means we have a lot of senior residents live in our Loma Linda city. So this city is very high risk because for the senior residents living in here. So let's talk about education, because from March 16th, our clinical education has been changed. So because now we cannot have any dental student in. So each class we have 100 dental students, and we have dental residents too. And my residents are also going to the emergency room. So now we close all the clinic, and then also now we're also taking the emergency room patients. So we are having to do the cases triage. So during this time, how do we face to these challenges? We have to start to do teledentistry. We are starting to do a lot of teledentistry, no matter it's in the video visiting or telephone visiting, and we have different code for each of the situation. So we do have a very clear instruction to the students, the residents, even they are not coming in, they're still going to all receive the phone call. All the call will be centraled, and then to send it to each of it. So when we're talking about emergency or non-emergency, because we say we're only open for emergency, what is so-called emergency? So here, emergency, according to ADA guideline, is only uncontrolled bleeding, cellulitis, or trauma that involve facial bone, potential compromise to patient's airway. And urgent dental care in the other side, that is severe dental pain, pericoronitis, surgical post-op treatment, like tooth fracture, dental trauma, dental treatment, and also final crown implementation. So I think one of the attendee just log on and turn on the microphone. Please mute. So this have already make us start to develop, because we have to react real fast. So what we do is we have all the students goes to the go home and stay online, but all the faculty stays and start to react. So what we do is we start to develop this flow chart. So how did you treat it? So with all the patients enter in the same entrance, and the nurses will ask all the screening questions, and then with checking the temperature. And if yes, then it will be screening, and with the different coloring to show how emergency it is. So if we're trying to do the separate the sick one, possible sick patient to the possible non-sick. And we also faced to a problem, because temperature was one of the first thing that we believe is a sign for COVID-19. However, that when you have dental swelling or cellulitis, there will be a temperature. So you need to screen between the temperature because of the cellulitis, or it's possible because of COVID-19. So then we use the decision by the screening dentist. The screening dentist is the one that has to be the most protected. So they wear the full gear. And then they go to, if they're in this side, you can see we decide what kind of PPE they're wearing. So N95, and then with a full gown. And so this side is they may be infected, but they are not dental emergency, then they will go back to their PCP. So for this side is the so-called safe patient. Then we were going to go to different department, and then the treatment will be done. So this part will be level 3 mask and face shield and the PPE. So that is our faculty all get together and then react real quick. And also for didactic part, all the faculty, all the program director from the pediatric dentistry. As I know, we have all the program director from all the different states. we have more than 80 attendants all show up on the Zoom meeting in a Sunday without notice. We were just having a notice that day, and then all 80 something program director all show up. Because once we change, what we're going to do is CODA. CODA have to have the report. What is the CODA? That is the education accreditation body. So they are the one who decide you can graduate this resident or not. So now we have the CODA, we have to report right away because with the clinical requirement and also didactic requirement. So for online education part, we have, you can see I have already put the screen on. In fact, I can change the screen. So online education, there are a lot of tools that we've been used. We have been used Zoom, we have used Panopto, we use Canvas and the lockdown browser. So you probably say, what are all this? So this is the navigation bar. You can see if we see it in one of our computer online courses. So Zoom is just like right now we're presenting, so we are all very familiar with it. Panopto is another one that you can do recording. So you can do recording first before you have the course, and then that will have the recording and the caption. And so that will be a good tool for pre-recorded courses. So Canvas is the body just to put all the modules and the tools inside. And the lockdown browser, that is for exam, because we will still need the exam. So what is a lockdown browser is to make sure they don't look to go to Google's or go to look for information. So what we ask the students to do is when they take the exam, they have the video face to them, and also to make sure they have this browser locked down so they can only see that browser. So I was going to go to share with you about the different share, because I think this one will be an interesting one for what is the ADA guideline for how do we teach and document teledentistry. So this is in the ADA's guideline for using teledentistry. What will be the using, so what can be used and called teledentistry? It can be live video synchronized, which is at the same time you're facing to a patient. Store and forward, which is asynchronized. So we save the picture, put it in the chart and send over. Or we can use a remote patient monitoring. So we use this to follow up. And then mobile health is for the care for the public health practice. So these are the one that I think is very useful, and you can find it online for the ADA guide for teledentistry and events. And also I was going to show you how we use the online education. So here we go. Can you see the online education there? Probably not. Let me make sure. Okay. So because of the short of the time, I'm going to stop the sharing, because I was going to sharing with the COVID, with the Canvas, so you can see how we teach it online. So here, I'm going to end this real quick. So impact of the COVID-19 effect to the dental education is a lot, but you have to be flexible and willing to face to the changes. There's a lot of technology can be used. I did show you some of the information that some of the technology we use, and it can help a lot. If anyone is interested, because I know the time limit, I only have 10 minutes, that's why I keep on looking at the time. So if anyone is interested after this, I believe we have FAQ, have a question discussion part. I'm more than happy to share how to use and how to teach that with all the different kind of tools. So be cautious, but not panic. So be patient and sit and relax. So I'm going to thank the President John Wei-Ren for invitation, and I want to thank my family and hope everyone health and have healthy and peace in your mind. Thank you.
Okay.
Thank you, Rongwei, Professor Chen. Thank you for sharing us those informations. Yes, I think you are right. We have to be flexible. Yeah. So, and now I'm moving the chair to President Zhang for the next session, please.
Okay.
Okay, thank you. Thank you, Professor Xu. And thank you for all of the participants. And we would like to thank the Professor Chen also give us a lot of new idea and the new concepts. So nextly, we would like to move to the Professor Osaka Ken, Professor Lianglin Xiao for the next speaker. Can we just invite Professor Xiao to be online? Lianglin, are you here? Yeah.
Can you hear me?
Yeah.
Yeah. Hi, good morning or good evening, everyone, because we all come from different time zone. First of all, before I proceed with my presentation, I would like to express my sincere thanks to Professor Chang for organizing this, and also Professor Alan Xu as well for this initiative. Okay, now that here's my presentation. Can you see the presentation?
Yes, yes.
Okay, all right. So the title given to me is Dental Education in Malaysia due to this crisis. Before I proceed, just allow me to introduce myself a little bit. I'm Liang Lin. I'm currently the Associate Dean at the International Medical University, which is a private university in Malaysia. And for the COVID-19 situation in Malaysia, as we speak now in Malaysia, we have 2,400 diagnosed cases and 34 deaths has been reported. And since the 18th of March, the government in Malaysia has ordered a movement control order for originally for 2 weeks until today, 30th of March. And last week on the 25th of March, the government has announced a renewed movement control order until 14th of April. This movement control order means all the unessential shops, for example, shopping malls and all that, are ordered to close. Only the essentials shops are allowed to open. For example, the healthcare, including dental clinics. For the government clinic, they are only seeing emergency cases, as alluded to with the last speaker, Professor Cheng. So only patients with pain, fractured prosthesis, that kind of emergency only the government clinic will receive. For the private clinic, it has also been advised to only treat private patients. However, it's up to the discretion of the practitioners. The Malaysian Dental Association has come up with a guideline as to what are the cases that is classified as emergency cases and non-emergency cases as well. So moving on to the dental education scene in Malaysia, at this moment, we have 6 public funded universities, i.e. the government universities, and 7 private universities in Malaysia, and all offered a 5-year dental degree course. And to control the program or ensure the standard of the dental program in Malaysia, we have 3 main governing bodies. The main one on the top of the hierarchy is the Malaysian Dental Council, which make endorsement or approval for all the policies made, especially from the Dental Deans Council. And we have the Malaysian Qualification Agency, who is the body that oversees the accreditation of all the dental programs in Malaysia. So for all the dental programs in Malaysia, the universities will have to go through accreditation processes to be able to conduct the program according to the program standards that has been outlined by the Dental Deans Council together with the Malaysian Dental Council. So for the program standards in Malaysia, we are looking at different aspects. The latest accreditation process has streamlined in the accreditation process into looking at 7 areas, i.e. the curriculum design and development and delivery of teaching learning activities, the assessment of the students, the selection of the students, the support staff, and the resources, and also the program monitoring process as well. So these are the main areas that we look into when the Malaysian Qualification Agency come to respective universities to conduct the accreditation processes. And for the curriculum, we look at the teaching and learning hours. There are fixed teaching and learning hours that is required by each dental schools, and the program learning outcome must cover 3 main areas, i.e. the cognitive, psychomotor, and affective domains. And for assessment, because the curriculum and the assessment are the 2 main areas that the accreditation will focus on. So all programs must have a clear assessment blueprint, printing using appropriate assessment tool to evaluate the program learning outcomes for each program. And this program must have both formative and summative assessment in almost equal proportion to ensure that students have learned according to the curriculum map. And prior to COVID-19, a lot of universities, or all, I would say most of the universities in Malaysia have their own online learning platform, either synchronous or asynchronous. This online learning platform mainly display online materials, for example, iLectures and quizzes for the students. As far as I know, there is no real-time, mainly real face-to-face teaching, or some of the universities use chat room, for example, Padlet for delayed responses to communicate with the students. And some of the universities, even before the government,
Malaysia 英文
I think, okay,
该香港英文还是 Malaysia 英文？我们听了觉得 OK 嘛，可在外国人听起来也是会觉得奇怪。
Can you please mute your speaker, please?
Yeah.
Okay, during COVID-19, even before the government ordered the so-called movement control order, 3 or 4 universities have already stopped all teaching and learning activities, including clinical sessions for students. In our university, we stopped it 2 days prior the university and the government put down the movement control order. So prior to that, the Vice Chancellor has already given us a heads up on preparation for this so-called partial lockdown. So the staff have a few meetings to come together to come up with a temporary student timetable because we are delivering online teaching in real time. So we are like Professor Chen has alluded to earlier on, they use Zoom. We use Zoom as well, but Zoom mainly for our postgraduate students. For undergraduates, we use Microsoft Teams. So as you can see from the screen, these are the screenshots from the Microsoft Teams. So the staff have quickly come up with the temporary student timetable. So all the cognitive teaching still go on as per the temporary student timetable, including EPBLs and e-seminars as well. So these are the synchronous teaching. So in terms of what Malaysian Qualification Agency has alluded to, this can still be counted as the teaching and learning hours, because as per the program standard, each program must fulfill 10,000 hours of teaching and learning hours, of which 60% are the clinical teaching. So after we have implemented this movement control order, as what Professor Chu and Professor Chen has mentioned, it affects our students. So the degree that it affects our students, it's slightly different in terms of whether they are junior students or they are senior students. Similar to Hong Kong University, a lot of universities in Malaysia, the current batch of the final year students are deemed to graduate in the summer, i.e. they will have to sit for their final exam in August this year. But with this effect of COVID-19, there are a lot of uncertainty because they lost out a lot of time with the clinical training. In Malaysia, all the dental students must have fulfilled the program standards, i.e. the minimum clinical experience. They need to have shown their competencies in caries management, root canal treatment for single-rooted teeth, fixed bridge, complete dentures, and management of child patient, and also simple extractions. So at this point in time, these clinical competencies will be severely affected because the students will lose a month of clinical experience here, and we are still not sure whether the government will lift the movement control order by the 14th of April. I will talk about after the COVID, what would we do as well. And besides that, students also need to complete their research project. At this point in time, the universities are closed to all students and all the research projects are coming to a halt. So post-COVID-19, what we need to think about after COVID-19. Do we allow the students to come all together or by cohort? So as per Professor Chu has mentioned, the priority will be given to senior students. So for cognitive learning, we may still deliver them through online to reduce the movement of the traffic in the universities. The senior management of the universities are even thinking of maybe only allow certain programs of the students come back to the campus on different days to reduce the human traffic in the campus itself. And how do we make up of the lost clinical time for the students? There are talk about the students will still go on to do the assessment, maybe to fulfill the requirement for the competencies. We may have to allow the students to come back even after they have finished their final year exam. So we also have to explore and see whether can we have support to conduct online assessment or not. At this point in time, in IMU, we already conduct our assessment online. we have been conducting our MCQs and our short answer questions on the online platform. And in place of OSCE stations, which a lot of universities do, can we use workplace-based assessment to evaluate the clinical competencies? So these are the aspects that we need to explore after the COVID-19 is more manageable and more under control in this point in time. So I'm also conscious about the time. So time given is 10 minutes. So we can have a discussion later. I thank you for all your attention, and I wish everyone well. Stay home and stay safe.
Okay, thank you, Professor Shah. Thank you, Professor Shah. Share a lot of experience in Malaysia, and we needed to face a new challenge, and we needed to make a new change after this crisis. So because of the time, we just would like to invite the next speaker, Professor Lin Yang Ji. Professor Ji is the chair of the public health of the Asia Pacific Dental Federation, and he also a professor of the National University Taiwan. So let's welcome Professor Ji.
Hey, hello everyone. I'm Lin Yang Ji, and I'm talking through my cellular phone. I must say that I'm not very familiar with this Zoom software, so I need to ask IO at the Association of Dental Sciences Taiwan to put on my presenting PowerPoint for me. So is that okay, Professor Zhang?
Yeah, wait a minute. Yeah, it's okay. Okay.
Okay. Can we have the PowerPoint slide, please?
Yeah.
While we're waiting, I have already uploaded my presentation. Thank you.
Okay.
Right. Okay. So my topic today is to present you the COVID-19 and dental services from the Asia Pacific viewpoint. But I cannot say that I'm very have got too much information about this very great area. So what I'm going to present you is some epidemiological figures from the Department of Health in Taiwan, so we can have some idea about the current situation of COVID-19 in Asia Pacific region. Next slide, please. Right. Sorry for the poor quality of the image, but still we can see this is the Asia Pacific region. So currently we have this is updated maybe 2 days ago. So the total number globally is more than 604 45,000 cases, and nearly 30,000 died from this pandemic situation. And the mortality rate is about 4.63. And altogether, 177 countries has got confirmed cases. Okay, next one. Okay, we can see from this table, it's also updated 2 days ago. Okay, let me put on my, right. So globally, and currently, the number in the US, I think we just was informed by professor in Nova Linda that the number of cases in the US has already more than 140,000. Okay, and so it's much more than the confirmed reported cases in China. So currently in Taiwan, we have about a bit less than 3,000 cases, confirmed cases, with actually should be three deaths. Another one just reported last night. We have 3 death cases. So the mortality would be about 1% in Taiwan. And we also have figures for Japan, South Korea, and we have very good situation in Vietnam and Cambodia, where no reported death in these 2 countries. Thailand has performed pretty well. The mortality rate is also less than 1%. Malaysia is very good, and but Philippines and Indonesia, we need to worry about them because the confirmed cases are more than 1,000, with the mortality rate greater than 6 and even 8%. And India and Pakistan is relatively okay, considering their huge number of population. Okay, so can we go back to the previous slide, please? Right, so we can see apart from the big dark color, brown color of China, we can see that the relatively mild situation at the Southeast Asia, including Cambodia, Laos, and Vietnam is okay. But it's the situation now. But we don't know what will happen next week or next month. So we still need to be cautious. Okay, next one, please. And next one. Okay, so I'm going to share with you what we have done here in Taiwan. So we have this Central Epidemic Commanding Center, CECC, which has been activated in 20th January. That's more than 2 months ago. And it was promoted to level 1, means the highest level, but with still the same chief commanding officer, Dr. Chen, who is a dentist in Taiwan. This level 1 CECC operated from 1 month ago. So the strategies suggested by CECC for the hospitals and the dental clinics as well is to triage and screening for patients with fever So once patient come to the hospital or dental clinic, they will be firstly asked for their TOCC. We will come to that later, and to monitor their body temperature. So if anything suspicious of this COVID-19, they will be arranged to another another route for their services. And we also limited visitors to hospitals, and we also are very important is to management of this outsourcing manpower. Means in hospitals there are many workforce which are not normally in the hospital, but because of some contract, so they work in a hospital. So these people, they are not very familiar with the infection control routines in hospital. And from the experience 17 years ago, from the SARS experience, we know that these people could be the problem of infection control. So this time we emphasize on this part as well. So from quite early in January, the surgical mask and the gowns, the alcohol preparations, they are all being rationed by central government. Okay, and all hospital medical professionals are required by the CECC to refrain from going abroad. So now we cannot go outside. It actually is for quite a long time. It's more almost 1 month to now that we are asked to stay in Taiwan, not going abroad, unless specifically allowed by the authorities. Dental services have been classified by the CECC as one of the high-risk health services. So PPE suggested are according to the higher level of infection control. And all this PPE will be given by the government in priority, including dental dentists and associates in the dental clinic. And all the non-emergency dental services, especially those generating aerosols, are suggested to be delayed to a later time. And the TOCC means travel history, occupation history, contact, and the cluster history have been used for screening to identify possible high-risk group. But currently, TOCC, because more and more countries and possibility of community spreading is possibly ongoing. So TOCC cannot be the only screening criteria. We need to be aware of any other possible infection source. Okay, next one, please. Right. I must say that the information technology of Taiwan's national health insurance system this time has been very helpful in providing the medical professionals about patients, their traveling history. So anyone who coming from abroad, from those countries with high risk, will be shown once their insurance card was inserted into the machine. So the at the first time, real time, hospital staff and dental clinic as well will be informed of their traveling history. Okay. And also the occupation history, including the airline staff, the stewardess, the captains, their occupation will also be provided through this information technology. And also the surgical masks, the rationing of these surgical masks to allow people to have 3 masks per week. That's for adults, and 4 masks per week for the children. We all go through this National Health Insurance information system. So to make this possible, I think this is important, especially at a time where when the surgical masks are in short. So everyone wants to buy surgical masks, but how to make it justified in allocating these masks. I think this is important to make everybody think it's fair enough. And all schools and universities in February, we delayed the new semester by 2 weeks. I think this is also important because that help to decrease social and community interaction when everybody in a society, in a government, is not so ready to combat this infection. CECC also calls press briefing every day, 2 o'clock in the afternoon, to provide the public the correct information, both domestically and internationally. I think this is important. At a time with confusion, it is important to provide the public the correct information. And in the meantime, anyone who's spreading fake or incorrect information, either deliberately or unintentionally, will face prosecution. So, so people will get the correct information, will not be misled by anyone who spread the false information. So currently, more than 50,000 people have been quarantined in Taiwan by the CECC. This is a significant number of people, and they have to stay at home for at least 14 days. And anyone who will not obey this requirement will face up to 33,000 US dollars fine for their incompliance. So, so many very strict rules, but still, according to the poll, the CECC actually has earned more than 90% support from the general public. So currently in Taiwan, we are okay. The dental clinics as well as the hospitals are operating their services mostly like what we were doing in the past. But of course, we will limit our service to those not so to those only emergent and those without aerosols. But generally, our service is still maintained. Okay, right. So this is what I'm going to share with you. Okay, next one. Okay, thank you very much for your listening and your sharing. Thank you very much. Professor Zhang?
I'm here. Okay, thank you, Professor Chi. So thank you for your presentation and share share the experience in Taiwan. And we also would like to wish that all of the world will be peace as soon. So because of time, we would like to connect the presentation. So next, we would like to invite the Professor Osaka Pan. Professor Osaka, are you here?
Hello.
Hello.
Can you hear me?
Yeah.
Okay, please stop your, okay.
Yeah. I'll stop. Yes, already.
So, hello, this is Ken Osaka. I just present the current situation of COVID-19 in Japan. So, I'm sorry, this is in Japanese, but recently we regularly confirm less than 100 people, patient. But these days, it's reached to the 200. And right graph is just the age distribution and men and women. And the 60 years old man is a lot of people are confirmed. And there's a gaps between men and women. There's three factors. Men want to, a smoking rate is very high to compare to women. Another thing is a previous study showed that men will not wash their hand to compare to women. Okay, and others is estrogen in women can protect the infection. So a man is more infected and develops symptoms than women. Okay, this is Financial Times just giving a slide. And Hong Kong, maybe Taiwan is also same thing, and Singapore is now controlling the outbreak. Japan is now want to try control outbreaks, and South Korea is maybe okay. So in Japan, there's a secondary cases occurred in the maybe temporary shelters. This is Hokkaido Winter Festival. Many people got together from international travelers, got together and very ventilated houses. They enjoy drinking and eating. And also houseboat where people drink alcohol and eat and singing a song. This is also the venue of cluster. Nightclubs and sports gym. I don't want exactly how can be transmitted in the sports gym, but sports gym, there's many clusters. And for especially younger generation, small live music house can be some epicenter for mega clusters. So this is a map of the chain of clusters. We are now creating these maps. The biggest one is the live house in Osaka, and maybe cruise ship and live house. This is tour from come back from Egypt, like this. And there are several clusters distributed in Japan, but Tohoku is now safe, and there's only 4 cases confirmed so far. And this figure, blue line is effective reproduction number. If this beyond 1, it's getting higher or outbreak epidemic. So if this number is less than 1, we can control. But unfortunately, recently, a little bit higher beyond 1, number 1. That means continue expanding of outbreak. And we create many advertising posters, and we should prevent 3C, a crowd condition. There's no ventilation, or crowd places and close contact, especially big conversation, could be a higher risk. Unfortunately, maybe there's several reports on the viral load in nasal swab and throat swab. This is New England Journal of Medicine showed that even throat swabs, some patients just the onset of symptom or before onset of the symptoms, there's a many titer of viruses existing. And other paper also shows Lancet infectious diseases, even saliva, maybe there's a 10,000 viral load per 1 milliliter and continue several days. And there are many reports from no symptom, asymptomatic cases or pre-symptomatic cases can transmit this virus. So in that case, dental practice, maybe there's a many routes for the transmit to the dental professionals, especially airborne. So this is summary for the dentistry. Asymptomatic and pre-symptomatic cases can transmit the virus. And recently, Italy and Japan noticed about the infected patient sometimes complain the taste disorder. So maybe some patient consult with dental taste disorder. It is clue for the infection. This is not same as SARS and avian flu. And droplet, fomite, and aerosol transmission may occur. And high risk of nosocomial infection. And dental treatment generates aerosol. And full PPE and ventilated room, desirably negative pressure is recommended, but usually challenging for general dentist practitioners. So our government is now thinking about consolidating function in well-equipped dental facilities, such as local public dental clinics or teaching hospital during COVID-19 epidemic. And for education, all lectures will be online delivered and clinical training for dental students now postponed. And all students return from abroad should home isolation lesson at least 2 weeks. And what would happen in the near future? So maybe confirmed case with mild symptom could stay home, not hospital. So in Japan, some 20% of dental practitioners going home visits treatment. It's maybe less risk to compare the hospital or dental clinic. What shall we do for that? And of course, US CDC's guideline and the postpone elective procedures and surgeries and non-urgent dental visit. But who will compensate this shutdown of dental practice? And this is the last slide. And how can we evaluate local epidemic situation? When we should stop the dental practice or for the general practitioner? And second, who should be responsible for this outbreak or this plan? Or university professors or dental association, and Ministry of Health and Welfare? Maybe we need a team. Okay. Third is maybe how can we exit this planning and when? Maybe it's this outbreak continue several months or more. So in that case, clinical training postpone, everything postpone, and when we can do exit plan. Okay, there's a many problems. Thank you very much. This is the last slide.
So,
Okay, thank you, Professor Osaka. And thank you for your presentation. And we thank you for your valuable presentation and valuable experience in Japan. We hope that Japan's situation will be better soon. And next, we would like to move to Professor Pahib to the next section.
yes, thank you. We will still need, and we still have three more speakers in this session. And the next one will be from Thailand, Dr. Atipan from Chulalongkorn will share with you the situation in Thailand. Please, Dr. Atipan. Dr. Atipan, are you ready?
Yes. Can you close the screen?
Yes.
Can you see my screen?
Yeah, we can.
Okay. Okay, first of all, I would like to thank Professor Chang and his team for very innovative innovation of this COVID forums today. And I would like to share with all of you the situation of the COVID-19 in Thailand. Information on the data from the higher education, science, and innovations together with the yesterday. So it's update information. Graph number of cases, which is from March 15 in Thailand. The y-axis can show the number of the accumulated cases, while the x-axis the day of after the 100 of the cases. From the graph, we can divide it into two different parts. The lower part is the country, show the countries that have a very good control of the disease, while the upper part is the country that have a limit of the control of the disease. For the situation of Thailand, we are in the red line. You can see here at the beginning of after the first case reported in the end of the February, we have a very, very slow progression of the disease. And until 6 days after 100 of cases reached, because of we have super spreader special event at the Thai boxing fight. I think you know from the news, which they are gathering almost 5,000 of the visitors in Bangkok. And after that, the number of the cases was increasing significantly. Moreover, it was spread to the rural area, which you can see from this pie chart, that the rural area have an infected case more than the Bangkok. So in this slide, another graph demonstrated the number of the new cases per day. As I told you, there are two important dates. First is the March 15, the date that we have 100 of cases already. And 6 days after that, as I told you, 21st of March, after the super spreader at Thai fight in Bangkok, there is a lot of a significant increasing of the number of the cases daily. The number of the infected was increasing, especially in the rural area from this line. This is slides also show you the progress of the disease all around the country, which just only 1 month. From the 1st of March, you can see here, and 2 weeks after after the first March, or is 15th of the March, and after 3 weeks, and after 4 weeks, all the country, almost all over the country is have a lot of infected cases. And finally, this is the situation of the COVID-19 in Thailand as of yesterday. So right now we have confirmed the infected case around 1,400 cases. 90% of the cases under treatment, 9% is recovered, 1% is in the severe situation, and 0.5% is dead. For the dental treatment in Thailand, right now there is no standard for the treatment protocol for COVID in Thailand. There are still controversy. One group of the dentists recommend to stop the dental treatment in all conditions in order to reduce the spread of the disease, while the other group of the dentists still doing the dental treatment in the condition of the emergency and urgency. Patients who need the dental treatment with the standard infection protocol manner, and also with the special protection, such as using the rubber dam, high power suction, PPE, N95 mask, etc. For the dental education in Thailand, all the lecture is conducted online mode. The student clinic is closed until the situation is getting better, but we don't know when. And the hospital limit the dental service just for an emergency and urgency case. That is all what is happened in Thailand and what is I would like to share with all of you. Thank you very much.
Thank you, Dr. Tipan. And you using a very nice demonstration and good timing as well. I think next we will have a professor from University of Columbia from USA, which, as you know, that in New York is now also another area of high prevalence also, and many cases also in the New York. Is Professor Tan. Huh?
Hello, how are you? Can you hear me?
Yes, it's okay now.
Okay. Let me first share my PowerPoint presentation. Can everybody see the PowerPoint presentation?
It's clear. It's clear. Please go on.
It's clear. Okay. All right. So it's a 12:47 at night, past midnight in New York City. So yeah, I had to take a little nap in order to make this on time. And first of all, I would like to thank Professor Chan and then all the other event organizers for hosting this great innovative event so that we could meet virtually, even though we're all in a different time zone. So let me go ahead and get started. My name is Philip Kang. I teach at Columbia University. And then, yeah, as all of you know, New York City is can everybody hear me well? Because usually when I talk, I would see a red frame around my photograph, but I don't see it.
We follow you well. Please go on.
Okay.
Yes.
Okay.
It went well.
Okay. Thank you so much. So yeah, New York City is one of the cities in the U.S. that's hit quite severely. So and this is the latest breaking news. I just got it from the website about an hour ago. So there's a coronavirus outbreak, a surge in the outbreak in the state of Louisiana. So the number has been increasing very rapidly over the past few days. And then everybody suspects that it's because of the Mardi Gras that took place back in the end of February, despite the controversy. So like so many people got together, celebrated this annual event. And then as you can see in the photograph, I mean, there's no social distancing at this place. So I think many people do attribute to the surge in the outbreak in the state of Louisiana to this event. So that, and overall, globally, U.S. This is the updated number only a few minutes ago from CDC. So now we have a confirmed cases of more than 142,000 in the United States, and the number is steadily increasing as we speak. And then I'm sure the previous attendees have already discussed all these different numbers, but in United States, we're being hit pretty heavily. And then we suspect that in 2 weeks, it's going to be at its peak, as President Donald Trump just discussed this afternoon during his interview. So yeah, so we're going through some difficult and challenging time at the moment. And if you look at this statistics, there was really no case until March, pretty much. So even March 2nd or March 1st, maybe there was about 10, 15 cases altogether in the United States. And all of a sudden, the number has been increasing exponentially. And this is the number we have now. The number as of March 29th, or almost March 30th, the number has become more than 140,000. So the number is increasing as we speak. And in terms of the geographic locations within the United States, East Coast, such as New York, New Jersey, Connecticut, Pennsylvania, and then also state of Massachusetts, you can see we have a lot more cases of a confirmed infection with this virus than compared to a West Coast or the Midwest. So I am in New York. I live in New Jersey, which is right next to Manhattan. So I am in the heart of this coronavirus outbreak. And then in terms of the numbers within the United States, New York is by far the most severely affected with this virus in comparison to other states. So New York has roughly about 60,000, and New Jersey has almost 14,000, and numbers are quite increasing. And I would attribute that to the lifestyle of New York or the East Coast in the United States, as people, there are so many tourists, and then people live closer to one another because it's a city life, more like a urban city life that we enjoy, as opposed to some other place in Midwest where we have so much land and houses are much bigger and people live like far apart, away from each other, more so than people living the East Coast. So New York is on a what's called a pause, and I'm not going to go into all the details on what pause actually represents, but if you look, there's a 10-point policy in the bottom left. It gives you a list of 10 different things that you should be doing or should not be doing, one of which is to stay home. Unless you're dealing with some emergency situations, or you should close your business unless it's an essential business. So what that means to dentistry. Well, before I talk about dentistry, this is a typical view of the Times Square. We have so many tourists, so many people. Everybody's from everywhere around the world, and now it's pretty much empty. So this is what you'll see in Manhattan, because people are told not to come out, and tourists do not come to New York City any longer. And then, in fact, many New Yorkers are trying to leave the city to go somewhere else. But then people from out of states will not welcome people from New York, as we could potentially carry the virus. So every New Yorker is told to stay put, not leave the city or the state, and then pretty much we're just staying home. So there's some changes that I've noticed in New York or in other parts of the United States. This is a typical photograph or a typical view that you can easily see in Asia. So if you go to Asia, you'll see the people wearing masks all the time, even if it has nothing to do with COVID or the virus attack. Okay? So in a period of COVID-19, I mean, I guess I got this photograph from like one of the Google images in a wedding ceremony. Everybody's wearing a mask, and this is quite extreme. But this is something you don't typically see in New York. People don't wear a mask. And this is what I see now more so than all the other usual days. There are still a lot of people who don't wear a mask, and then I'll see them in a like supermarket. And I don't think they actually understand what the purpose of the mask really is. They do a little Google search on how effective this mask is in terms of preventing disease spread, and then they think, oh, it's really not that effective. That may be true, but I mean, here we should always assume that we are the infected people. I may carry the virus. So by wearing a mask, I'm going to prevent with the spread of the infection from me to others. And I think people don't really understand that type of a phenomena. So I really don't see that many people wearing masks, but as time goes on, I see many more starting to. And this is New York City. On the upper left photograph, this is a New York Presbyterian hospital. And this is my the entrance that I used to go to work every day. And now the medical center, in front of the medical center, they have this tent to screen all the individuals with suspected infection of COVID-19. And this is another tent in a Bellevue hospital. So this is what's going on in New York City. So not that many people are around. And then there are like external locations in front of hospitals to screen patients before we actually admit them into hospitals. And of course, there's still people having fun. I mean, it's very New York, right? Let's see. So what about dentistry? Well, for the past 2 weeks now, depending upon which state you live in, but I think it has been quite uniform in that we were required to close all dental practices, except for to treat emergency patients. So Columbia Dental School has shut down pretty much for the past 2 weeks, but we do have emergency clinic where emergency dental care is still provided. In terms of private practitioners, yeah, all private practices were forced to shut down except to treat emergency patients. And then depending upon which state, for example, in the state of Oregon, they're told to close until the end of May. And then in the state of New York and New Jersey, we're expected to close until April 30th. So what does that do to our dental practice? Nobody really knows. People have filed for unemployment benefit because offices are closed down. There's really no other source of income. So many practitioners did apply for the unemployment benefit plus the small business loans with a very low interest rate that was funded by the federal government. So we're still in a state of panic because we don't really know what we can do. I mean, if we're closed until the end of April or end of May, I don't know how many businesses can survive. So many people are very worried. So after we open up the dental office, what's going to happen? What are some of the things that I foresee happening is that infection control protocol. I mean, this is what I've noticed. So on the bottom left, this is how we typically treat our patients. I think that's going to change. I think we're going to be gearing up with a lot more armamentarium to prevent any possible infection. And I'm sure patients will be very scared to come to see dentists for the time being. So even if we're allowed to open our practices in May or June, I think there are like vast majority of people who will be very hesitant to coming to dental offices because of the spread of the virus. So another possibility is that the tele-dentistry, online consultation or phone consultations, many dental insurances have started to reimburse for those procedures. So doing all this tele-dentistry is something that we're going to start seeing more and more as days go on. As I mentioned, what does this do to our dental education? Columbia was shut down, and it was probably one of the first few universities to shut down in the United States. So now all classes are being conducted through online mechanism, namely Zoom, the same app that we're using now. So for college level or non-clinical studies, this is going to be very helpful. But what about clinical education? Dental students, residents, they need to see patients in order to gain their clinical experience. But this is something that is impossible at the moment. So we're doing everything we can to do virtually to assess their clinical competencies. And then in terms of didactic responsibilities, I am working closely with our colleagues at Harvard, UPenn, and NYU so that we could exchange our resources as much as we can so we could gain or we can help our students gain as much knowledge as possible. And for example, we're sharing all the courses, not all, but pretty much all the information that is available out there. So there are a lot of so many online free CE credits now that was supposed to be not online. So because people cannot get together now, they converted all these gatherings into online virtual courses. So there are many CE courses that are available out there. So we're trying to maximize the utilization of these online opportunities. And just to give you an example, this is my schedule for this week. So we have all these courses being conducted through Zoom. So we have Dr. Papapano's lecture and some of the other lectures from other faculty members. And then we have like full day of implant lectures from Dr. Tarnow, Wednesdays, Thursdays, and Fridays. So we have lectures and seminars, case presentations, research presentations, so that we keep our students really busy in this time of challenge. And of course, in the beginning, it took us a little while to get used to all these, but now I think this is there's a great benefit to this online education as well, because now as what we're doing, we could meet so easily without having so much time limitations or geographic limitation. So if we could expand this, I think, or we could talk to us, Dr. Chen, Professor Chen, to give a lecture to Columbia residents and students. And that's going to be done so easily without necessarily traveling all the way to New York City, which he had to do. And now with this online opportunities, I think it's much, much easier. And even after the COVID-19 issue, I think this is going to continue. So I think we learned quite a bit from all these events. And all I can say as I try to, as I conclude my presentation is for you, for all of you to stay safe by staying home, because after a certain period of time, I'm sure just like everything else in life, we're going to come back to our normalcy and enjoy the type of lifestyle we used to enjoy. So I wish everybody to be safe, stay well, and then in the near future, I wish everybody can join and visit New York City and Columbia University if you're around. And if you have any questions, any comments, you could always reach me at this email. So thank you so much for your attention. And then after I'm done, I think I can finally sleep. Okay? Thank you so much.
Thank you very much, Professor Kang, for a very interesting summary of the situation in New York for us all. I think we still have one more presenter. If you don't mind, we will move to the next presenter from Korea, Professor Kim from Busan. Professor Kim, are you ready?
Professor Kim, are you here?
Oh.
Okay, maybe we cannot find the Professor Kim right now. So, thank you for the Professor Pahip.
Yeah.
And
Okay,
thank you for all of the participants to join this online forum. And we talk a lot, and we discuss a lot. And do you have any question or any comment to our presenters today? Okay, thank you, Professor Pahip. Because I think Professor Kim cannot be online right now. So we would like to end of this forum now. So it's okay?
Yeah, thank you very much, Professor Chung and Professor Alan Shu for organizing this. It's very informative.
Yeah, thank you, Professor Shaw. And we would like to end of this forum today. And thank you for your all of your the presenters, and thank you all of the participants to this forum. Thank you so much, and hope to see you in the future, or in the any place soon. Thank you so much, and hope the world goes to well soon. Thank you so much. Thank you for your coming.
Thank you. Stay safe, everyone.
Thank you.
Bye.